Hello everyone, I am Dr. Saurabh Bansal. I am a gastrointestinal laparoscopic cancer and robotic surgeon, and we are here live from Apollo Spectra Hospital, Chirag Enclave, New Delhi. And today I have been given this opportunity to speak about common GI disorders. As we all know, gastrointestinal disorders in our community has prevalently increased over the decade, and we see a lot of new problems coming up, including common gastro problems to GI cancers. So today my job is to give you a brief overview what we can, what we need to do when we suffer from those symptoms, what we should suspect, and how we can go ahead and meet the specialist, which specialist to meet, and how we can further treat it. So I will give you a brief review about it. So, as we see, most common patients in our OPDs are with the symptoms of dyspepsia. Now, dyspepsia is a scientific term. Dyspepsia in layman language means indigestion. So, there are some 8 to 10 symptoms of indigestions which we commonly encounter. One is like you feel very full after eating food. Fullness, bloating, you feel burning sensation in your stomach, you feel constipation, you feel excessive belching. Belching is like dhakar lena, bahut sari dhakar lena. You feel heartburn, you feel like your body is getting numb after eating food, you feel very difficult to breathe at times because of the gaseous distension of your abdomen. These are the typical symptoms of indigestion generally patients face once they develop this problem over a longer period of the time. It doesn't happen with a one day infection or 2 day infection. It's a long process when this infection starts building up and you start having symptoms of dyspepsia. Now, if you look at the causes of indigestion, you just do not take it very lightly, because indigestion doesn't happen generally. Indigestion generally happens because of acid peptic disorders, which means simply like duodenal ulcers. जो स्टमक का फर्स्ट पार्ट, जहाँ पे इंटेस्टाइन का जो फर्स्ट पार्ट होता है वहाँ पे जाती है, जहाँ पे फूड, दैट इज ड्यूडेनम, उसमें अल्सर्स हों या स्टमक में अल्सर्स हों. सो स्टमक एंड ड्यूडेनल अल्सर्स आर वन ऑफ द वेरी मोस्ट कॉमन कॉजेज ऑफ दिस काइंड ऑफ डिस्पेप्सिया. The other reasons which we see this problem is gallbladder stone disease and gastric cancers as well as pancreatic cancers. Sometimes, many times I have seen when patients have ignored their symptoms of indigestion, and we do an endoscopy and we found that they're having a stomach tumor or a pancreatic tumor in their endoscopies. So once you are having these symptoms chronically, if they are persisting, I always say more than 1 month, you should always seek a specialist nearby you whom you can speak and they can further investigate you. So generally, once you have these symptoms, we do an most investigation is an ultrasound abdomen and an endoscopy. Endoscopy is an OPD based procedure. There is nothing to fear about endoscopy. It can be done under local anesthesia. It's a painless, absolutely painless procedure. Should be done only after you kept being nil by mouth for almost 4 to 6 hours. The report comes immediately and your treatment has been started immediately if you are having an ulcer disease. So if you are having an ulcer disease, then your usually treatment remains for the duration of around 8 to 12 weeks, which we generally do so. Next common GI disorders which we routinely see is reflux disease. Now reflux is also known as GERD. GERD is nowadays very common in young people because of our habits like smoking, alcohol, having fast foods, having spicy, oily food, having late night munching. So, we see these patients very frequently, people working in corporates, even our staffs, even our doctors, they do suffer from some or higher amount of reflux problems because of our nowadays the nature of our lifestyle which has begun. So reflux symptoms are generally, it's like epigastric burning, like the burning in the upper part of the abdomen as well as the burning behind your chest wall, behind your center chest bone. So you will feel continuous burning and you have a bitter sensation in the mouth or something coming in your mouth. You eat the food and something coming in the mouth which is very bitter, tastes like an acid or something. Then you have other symptoms of refluxes like a discomfort in your chest, asthma, or a chronic cough or a sore throat. These are other secondary symptoms of reflux disease. Now these reflux disease long term should not be ignored, because you should begin your treatment as they can damage your esophagus. Esophagus is your food pipe, so lower part of food pipe can be damaged if you are suffering from a chronic reflux problem. So once you have a reflux which is persisting more than 3 to 4 weeks and it is not getting treated, cured by your routine medicines which are available at the chemist. We are taking nowadays, everyone knows about taking PPI drugs and all. I won't name the brand here, but routine syrups and all. If it is not resolving, you should meet a doctor, and you should get consulted. See, the only test which we need to do is an endoscopy here, and we diagnose the reflux disease by an endoscopy. In some cases we require 24-hour pH studies and manometry to further document any other problems with esophagus problems. So patients who have chronic reflux, who have been this reflux problems and taking medicines from long years, they are generally advised to go with a permanent solution, which is in very simple anti-reflux surgeries, which requires 1 to 2 days of admissions, which we are doing very oftenly here. The third most common problem which we encounter is an IBS. So before I speak about irritable bowel syndrome, which is IBS, I just want to highlight about the gut-brain axis. So gut-brain axis works in two ways. So one is that your central nervous system, your brain is sending signals to the gut, the entire small bowel and the large bowel, and they act to the gut act to the signals by the brain. Mainly these are hormonal signals and neural signals. Hormonal signals are where the gut secretes number of hormones, and the various organs secretes various hormones for the digestion of our food as well as movement of our gut. And the gut signals back to the brain that that okay, this my job is over, now next part is going to come. So it's simple. If I give you an example, like if we eat the food, so when we are hungry, we feel like we need to eat so much. When we start eating, our stomach gives a signal to the brain, okay, I'm feeling full now because I can't have more food. So our brain will give signal to the stomach that you don't need to eat more, your stomach is full. So that kind of a neural signals which comes into the system, which is called the gut-brain neuroaxis. So mainly this problem, and there is another nervous system which is called enteric nervous system. These are like spiders, right? So spiders, like neurons, are there entire gut, in the colon and the small intestine, which helps them to move forward. So whatever we eat, it goes to the small intestine, stomach, and large intestine. So it is helped by the entire enteric nervous neurosystem. Now the common disorder which we know about this gut neuroaxis, which is most in talk, is the IBS. IBS have some certain symptoms where there is disturbances in the neural mechanisms of the gut, and patients will have a severe lower abdominal pain. Suddenly they will have a diarrhea, and some days they will have a constipation. They feel bloated all the times. It is not that can be cured, because there are a lot of medications now, and generally IBS is a diagnosis we make after an exclusion. Generally we look for other problems in our gut which can be treated, and if we find no other reason, then we label it as an IBS. Before labeling IBS, we also try to rule out irritable bowel disease, which is ulcerative colitis and Crohn's disease. So if you have read about a recent article about the gut microbiome, so it's say that microbiome gut-brain axis, which has lately been published in US journals also, which says that if your gut microbiome is disturbed, you can not only have IBS but also have symptoms of psychological symptoms like anxiety, depression, and other disorders. So people say that if your gut microbiome is disturbed, you can have these symptoms, but then again there's a long way to go ahead where we can particularly tell you this, that okay, if we take this bacteria, we got a right balance. But in general you see that, so it's more important that if your doctor is prescribing you probiotics and all, you should take that probiotics. And I feel that most natural probiotic is you take a lot of curd, that is dahi, if you have these symptoms. So next topic related to this, I feel we are talking about the brain neuroaxis, is when you have a diabetes, people you oftenly see they have more stomach issues, because diabetes, overall what it causes is it causes slowing of the entire gastrointestinal system. So once you have a diabetes, which is diabetes not under control, the stomach has a tendency not to contract. So once we eat the food, it goes into our stomach doesn't contract properly, so it doesn't pushes the food forward. So the food tends to stay in the stomach for a longer period, and the patients will more oftenly complain about they feel full every time. So this kind, and secondly, diabetics will have a more of constipation problems. More constipated patients are diabetics. So these kind of problems, once they encountered, we need to do a specific testing, and we need to control their medical conditions, as well as we can give some supportive measures to so to activate their entire system. Now after some common GI disorders, we come to most topic which people are scared to discuss, or people are afraid to listen that word in our lives, is cancer. So GI cancers, gastrointestinal cancers, is wholesome, is a multiple organs in our gastrointestinal system, right? So gastrointestinal system compromises of solid organs as well as hollow organs. Solid organs, by solid organs I mean liver, gallbladder, spleen, pancreas. And by hollow viscous organs I mean food pipes, stomach, and small intestine, large intestine. So generally, there is the symptoms of all this kind of cancers are quite different. They present differently, and when we diagnose it, it's a high index of suspicion at times, or sometimes you get a test for something else and you are diagnosed with certain disease which you were not expecting actually. So in general, if I talk about, one should be, there are certain symptoms one should be very careful about it and always visit a nearby doctor, is that there is as I said, first we'll start with, there is a disturbances in digestion. Once you feel that your digestion is not remaining good for a prolonged period of a time, you should always seek an opinion, because it can be some major illnesses also. Any blood in the stools, when you feel it like your stool has become more maroon or black in nature, or you see some fresh blood in the stools, then also you should seek an opinion of a doctor. Third most common symptom which we encounter is sometimes you feel diarrhea, and sometimes you feel lot of constipation is happening. That is altered bowel habits, which is a frequent symptom of colon cancer, badi aanth ka cancer, large intestine cancer. The other symptoms which are very common in liver problems or pancreas and bile duct problems is a jaundice, where patients suddenly start appearing jaundice without any pain. Patient बोलेगा कि मेरे को कोई दर्द भी नहीं हुआ, मेरे को कोई बुखार भी नहीं हुआ, and then we have suddenly patient starts having jaundice, and it is continuously increasing. Then the other common symptoms which we should not never ignore is loss of weight, loss of appetite, weakness, मतलब थक जाना, आप कोई कोशिश नहीं कर रहे वजन घटाने की, फिर भी वजन घटे जा रहा है, अननेसेसरी थकान हो रही है, तो भी ये सिम्टम्स को कभी आपको इग्नोर नहीं करना चाहिए, बिकॉज ये भी एक एडवांस डिजीज़ या एक कैंसर के लक्षण हो सकते हैं. सो in all said symptoms, it is very important that when we seek a diagnosis, when we reach a specialist, they will investigate you with a common blood test, and whatever suspicion is having accordingly. If it is they are suspecting a stomach cancer or a food pipe cancer, generally we do an endoscopy. If we suspect a colon cancer or intestine cancer, then when we do a colonoscopy. And secondly, we take a help of CT scans and MRIs to diagnose the disease, and PET CT scans to stage the disease. But it is really important in this GI cancer is that we diagnose them in time. Never ignore your symptoms to that stage that it becomes untreatable. If we diagnose it earlier, the prognosis, the outcome is as good. After your treatment, you will be living a life like a normal person. I have so many patients whom I operated before 10 years. We treated them. They are living almost normal life as if nothing was happened before. So it is really, really important that we should not ignore this kind of symptoms once we diagnose a case of a cancer. So people, हमें लोग ज़रूरी आके पूछते हैं, people do often ask me कि सर ये सर्जरी होगी तो बहुत बड़ी सर्जरी होगी, this will be a very big surgery, कितना बड़ा कट लगेगा, कितना स्कार होगा, what will be my recovery time, how many days I have to take rest at home, how many days I can't go to the office. So generally, nowadays the things have become so advanced that we do, if diagnosed timely, we do our surgeries by laparoscopy. Laparoscopy is, that we do surgeries by using small holes, like for gallbladder surgeries or hernia surgeries or even bariatric surgery, weight loss surgeries. So same way, these small holes are used for cancer surgeries also. Now, what happens with this surgery, and also robotic surgery is same. So you use keyholes to do the robotic surgeries also. So the advantage of this surgery is that the patient recovers very early, the patient starts moving out of bed so fast, the patient lung function is good after surgery, the patient overall recovery becomes faster, smoother and earlier, so he can early go to the home and he will not have big scars like our traditional open surgeries. But it doesn't mean that this laparoscopic robotic surgeries have replaced traditional surgeries, but yes, to the extent that most of the surgeries we can do by nowadays newer methods, traditional surgery still plays a bigger role in major surgery, in advanced cancers and the cancers where we cannot use this highly advanced methods for those surgeries. So with this I want to also tell you small thing about as we are catering the services of weight loss surgery, Apollo Spectra has always been known for same, and we have recently introduced our 360-degree program where we are offering our patients medical management as well as endoscopic management as well as surgical management of weight loss. So medical management, we have recent advances of certain medicines and meal replacement proteins, and these things help in some small amount of weight loss who are intending for 10 to 15% of excess body weight loss. We have recently come up with an dissolvable balloon where we don't need to do an endoscopy and patient can have that balloon, and which provides extra almost 15 to 20% of the weight loss. And surgery remains the gold standard in excessively obese patient, obesity grade 2, 3 or obesity with you have comorbidities like diabetes, hypertension, obstructive sleep apnea, all osteoarthritis. These patients will be much benefited by the use of bariatric surgery. So all in all, digestive disease is a big Pandora where we have multiple organs, multiple problems to deal with. And if you if you have any questions, you can please write us, you can ask us. I'm here to answer you, and it was wonderful. I hope you enjoyed the whole overall conversation. I feel there are certain questions where we can take it up. So can we have our first question?
The first question is, can only stones be removed from gallbladder for gallbladder stones?
Okay, so this is a very common myth when patients come with an ultrasound report that gallbladder stones can we remove only the stones and keep the gallbladder there. Actually, there is nothing like this. The gallbladder stones form because the gallbladder function is hampered, and it happens because of the stasis of the bile. The bile in the gallbladder combines with the calcium and cholesterol, it forms the stones. So already once the stone is formed, the gallbladder is not functioning. So generally the gold standard around the world is to remove the entire gallbladder, not only the stones. So, and it's a very safe and elective surgery, and generally you can discharge your patient on the same day if you operate in the morning, or by the next day once they are comfortable. Next question.
What is the permanent solution for GERD?
As I discussed, that GERD is a very common problem, and many of the patients who have been taking medicines from 3 years, 4 years, even 10 years, 5 years, this reflux problems are sometimes associated with hiatus hernia also, which we diagnose in the endoscopy. And we personally feel that, and many centers across the world also feel that the anti-reflux surgery done in a proper way by laparoscopy or robotic gives you a permanent solution and lifetime relief of the symptoms.
Which GI cancer is common?
In India, in northern India, we see too many gallbladder cancers also, and colon cancer is among one of the most common cancers across Western countries, and India also. I feel the GI cancers, we see colon cancers quite frequently, and gallbladder cancers also, because gallbladder cancer is entire whole big topic, so I think we will discuss it some other time.
What are the common symptoms for colon cancer?
So the common symptoms of colon cancers if we look into is सबसे पहला symptom होता है कि you feel like a lump in your abdomen, you start feeling like there is something in your abdomen, you can feel it. उससे पहले होता है कि you feel your bowel habits are altered, like you used to go to stool for once a day, now you are going 3 to 4 times a day, or once you were going normally 2 times a day, but you are not going stools from now 2-3 days. So there is an alteration of the bowel habits, there is a change in the color of the stools, it becomes more brown or black or red in nature. And there is in lower cancers, in rectum cancers, there is a urge to go to defecation again and again, so you feel like you have to go to stools again and again, and you pass lot of blood and mucus in the stools. And sometimes in severe cases, when you are not seeked advice in a timely manner, the cancer can block your entire intestine, and it can cause obstruction of your bowel. And the other symptoms, common symptoms, are weight loss, loss of appetite, and if it is spread to other organs, they will have different symptoms.
What are the common symptoms of liver disease?
Yes, so liver disease is a very common problem again, and which we encounter routinely, because there is a fatty liver associated liver disease and alcohol associated liver disease, which we see both quite frequently. And common symptoms of liver disease, once they remain untreated, is that you start developing jaundice, you have low appetite, you have distension of the abdomen. Distension of the abdomen means पेट फूल जाना. पेट फूल, that distension of the abdomen usually happens when you start developing fluid in your abdomen. It happens because your liver is not functioning and your protein synthesis, protein जो liver बनाता है वो बनता नहीं है, तो जिससे पेट में पानी इकट्ठा ना होना शुरू हो जाता है. तो पेट फूल जाना, जॉन्डिस हो जाना, मुंह के रास्ते खून की उल्टी होना, भूख ना लगना, बहुत कमज़ोरी लगना, ये सब बहुत ही कॉमन सिम्टम्स होते हैं एक लिवर डिजीज़ के. बट मैं यही कहूँगा कि ये थोड़े से सिम्टम्स एडवांस लिवर डिजीज़ होती है जब लिवर ऑलमोस्ट 70% डैमेज हो चुका होता है. बट दैट डजंट ऑल्सो मीन दैट वी कैन नॉट ट्रीट इट, वी कैन ऑलवेज ट्रीट इट. जब फिर भी सिम्टम कंट्रोल होकर मेडिकल मैनेजमेंट फेल होता है, देन देयर कम्स द ऑप्शन ऑफ लिवर ट्रांसप्लांट.
Is it possible to remove GI cancers by laparoscopy or robotic surgery?
Okay, so he meant to ask a very common myth that many patients ask me, that कि सर ये कैंसर पूरा तो निकल जाता है, कुछ रह तो नहीं जाता जब हम दूरबीन से करते हैं, रोबोट से करते हैं. So I just want to convey to all my listeners that the amount of vision we have in laparoscopy and robotic is more than 10 times which we see from our normal eyes, because the camera and the technology is so advanced that you almost see 10 times bigger the structure. So even the precision, even the whole accuracy of the procedure becomes so high that the dissection and the pura tumor, the removal of the tumor becomes complete with this technique, and we can safely remove the tumor using a small cut in your bikini line or in your umbilical area to remove the entire tumor. So we can save big cuts, and it's not about cuts also, it's about the overall recovery and the overall journey of a cancer patient once they undergo a surgery, because their early recovery is also important if they are supposed to get any chemotherapy or after surgery, so that begins also earlier.
Thank you.
Any more questions, you can please write to us, email to us, or call us at the below given number, or if you have any symptoms you can connect any nearby Apollo Spectra hospitals. We had a wonderful session over here, and thanks for having a patience listening with us. Hope to see you again. Thank you so much.